Welcome to the first interview at the Global Health Desk. Rithika and I had the pleasure of interviewing Professor Charlotte Watts, who is one of the world's leading voices in public health and global development. Charlotte has pioneered research that has changed how the world tackles gender-based violence. She's also advised governments on major global challenges like COVID-19, infectious disease epidemiology, and climate and health. Professor Watts has spent her career turning evidence into action. She spent 9 years in leadership roles within the UK government and served as the UK's most senior scientist for international development. She also actually originally trained as a mathematician, and her interest in global health really emerged during her postdoctoral research on HIV epidemiology at the University of Oxford. Then she went on to serve as professor at the London School of Hygiene and Tropical Medicine, where she led large-scale international research programs. Now, as an executive director of solutions at the Wellcome Trust, she leads programs focused on improving health and well-being globally.
Hi, Charlotte. Nice to meet you. Thank you so much for doing this for us. I'm Ritika. I'm an MSc student at LSHTM doing public health. And
Yeah, and I'm Sophia. I'm also doing my public health at LSHTM, and we're just really
Lovely.
excited.
No, my pleasure.
Thanks for making time for us. And we were just like, in the interest of time, we'll just get right into it. That's okay with you.
Yeah.
So, we were really interested in your body of work on violence against women. It's a really impressive body of work, and you demonstrate things like it's linked to mental health outcomes, its global scope, how things like education level, socioeconomic status can impact it. But getting violence against women onto policy agendas is notoriously difficult, especially when policymakers want like hard numbers and measurable outcomes. So I wanted to ask, what were some of your biggest challenges you faced when in getting that issue taken seriously, and anything else you want to share about your experience with that body of research?
Okay. Yeah. I think I've learned a lot from doing the work on violence against women about how to get sensitive issues on the agenda. So at one level, there's a few different layers to how I'd answer that. So at one level, and this was what I think we thought about very carefully when we were doing the WHO multi-country study, is and so that was the first global study to measure the prevalence of violence against women, and it came out of the Beijing Commitment for Action on violence. And essentially, when we were developing the methods, and the methods weren't established then, we were thinking about how do we develop reliable data that actually is both operational, so it was a short module of questions, but also that wasn't open for challenge. So like it didn't try and, so we focused on, in that case, physical and sexual violence. We knew from women's testimonies that psychological abuse is really important, very detrimental, but actually we didn't know how to measure it well. And the risk was you would go, oh, this person used hurtful language towards me, abused me or insulted me. That can happen in relationships and it's not violence, right? And so because we didn't know how to do it, we said, actually, we're not going to include in our prevalence figures psychological abuse. We're going to stick with physical and sexual, because actually it was easier then to get measures that people could understand. And they were very behaviorally explicit. So it was punched, it was kicked, it was use a weapon against you. So like when you're presenting the data, people go, oh, well, it's just, just extremes, but the kind of extremes you might get is, oh, it's just a whole lot of women complaining. No, this is the prevalence who've been punched or kicked. These are the percentage who've had severe violence against you, a weapon used against them. So it was knowing that it's going to get challenged from the outset, so that we weren't trying to get the perfect measure, but the one that actually would get people. We knew the number would be big, right? It was 1 in 3. But it was like, we don't have to do everything to get that 1 in 3, in a way, a number that actually is easier, is less vulnerable to attack. Because if people go, oh, well, most of that is insulting language and people do that anyway, it could dismiss the whole figure. So it was, and it was because we'd all worked on violence a long time, so we'd all had the kind of pushback. So there's a first bit of actually being savvy in what you try and measure, recognizing that it's going to be challenging. I think the second element that we first started to talk about the prevalence and its links to health, having evidence on the links to health, be it mental health, maternal health, is useful because you can then make a link. So violence against women might not be on the health agenda, but maternal health might be, or mental health might be.
Right.
So then you can talk about, well, you care about this health agenda. Look, this is the role that violence against women plays in that. So you need to pay attention to this. So that's the sort of second bit of recognizing and thinking about what are connections to what is on the agenda. I think the third element is, and this is, because I was a sort of at London School and then I was in government as a scientific advisor. And what I learned there is there's lots of important things that politicians can do something on, right? But they have to choose where is it where they think they can really have an impact, right? And so to say this is a big issue alone, or this is a big issue and it has bad health impacts, without saying this is what we can do to prevent it, or to, then it's like, well, I don't know what to do. And I've got an alternative where I know what to do, right? And so actually what happened in the Violence and Health Centre was initially it was how do we measure it, how do we understand the associations, how do we understand risk factors, but then we evolved to but then you were seeing people going, it's 1 in 3, actually that's too big, right? It's like, that's really difficult. How do we so, and then when you think about it, it's 1 in 3, you have to do prevention, right? You can't treat your way. And services are important, but services can't be the answer if 1 in 3 women experiencing violence. So then that's what led to us starting to do work on violence prevention. And so the first trial we did in rural South Africa, everybody was talking about how we need to empower women economically and socially, but nobody was testing it, right? And you'd see it in a report at the beginning saying, oh, women are vulnerable economically and socially and they get beaten and it's got links with HIV or whatever. And then at the end, you'd have policy actions and then there'd be nothing about violence. And then in the end, they would go, oh, and violence is still important. It was, so the first trial we did was an economic and social empowerment intervention. And we thought both about how do we make it deliverable and short, but also a model that's scalable. Because the other thing policymakers want to do, they don't want to just say, oh, I can do something in this village, right? Or actually they want interventions that they could bring in as policy. Is it policy change, or is it something that's naturally scalable? You can do it in a school, or in our case, through a microfinance program that we're scaling. How do you add on an empowerment component then it's going to scale on its own, right? So we were thinking about those sort of scalability questions when we were thinking about what the intervention was to test. And there we had a 55% reduction in violence, past year violence. So that's
amazing.
Which is very cool.
I actually love that you answered it the way you did, because so many of my other questions are basically about this.
Okay.
And so much of our degree, I feel like we learn about how difficult it is to measure the impact of an intervention. Like that's something we've really been coming across again and again. But I first wanted to talk about, so I grew up in Pakistan and I'm familiar with how stigmatized topics like violence against women is. And it's such a taboo topic. There's a lot of shame surrounding it. And then actually, dealing with these really complex societal norms and issues. But then what was your experience, I guess, working on these highly stigmatized issues like intimate partner violence or HIV even, and then designing an intervention that's context specific and flexible enough to actually shift these deeply entrenched community perceptions. Like that is actually what blows my mind.
That's a massive question. So I think firstly, like in the UK, there's this expression of rule of thumb, right? And the rule of thumb comes from an old law that we used to be able to, the UK people used to be able to beat a woman with a stick as long as it wasn't bigger than their thumb.
Oh my God.
And now we go, oh my God. So there's one bit of like norms are there, but norms are changing, right? And actually I get hope in every new young generation come through, in a way are questioning and rebelling and going, what do I want? So there's a bit of recognizing norms can change. And, actually that rule of thumb was 100 years ago in the UK, right? It's actually relatively recent in history. And so And in any, firstly, I mean, the core thing with interventions is you have to work with local communities and local groups. So actually, the interventions that we've evaluated have always been interventions that are built on initiatives or even quite developed interventions that have come up from civil society groups. And our role has been, how do we evaluate those rigorously, and how do we understand them? And there might be tweaks on things, but it's sort of, in a way, I've always avoided trying to be, the idea that an academic can make up an intervention versus actually what are local groups, what's the women's movement doing, what are we learning from others, and then how do we bring, in a way, the technical measures to do a cluster randomized controlled trial, right, to that. So there's a bit of a humility in, I think, of how you act as a researcher, that is, it's an accomplice and an aid versus somehow, because you've got a degree or whatever, you've got all the answers. But I think the other thing, and it comes to that point about actually the kind of questions you're asking, if there might be a social norm that's saying, yes, you can, it's okay for a man to correct his wife, beat his wife. But actually, if you then said, but what if she ends up in hospital? They would say, oh no, he went too far, right? So often there's limits to those norms. Or if you say, would you wish that for your daughter? People would say no. So sometimes those sort of expressions of this is what the norm is, and it's clearly stigmatized, and women bear the blame. But actually there's layers to those norms. And so then when you're engaging with those norms, some of the sort of norm changes are actually, how do you take people through a bit of and Sasa did this very well, that process of reflection and go, well, yeah, no, this is the thing that we grew up with and that's expected, but actually let's talk about the implications of this. Let's start reflecting. And in any conversation, you'll end up with different views, right? And, some of the strongest advocates against violence against women I've met, for example, men who've grown up where their mother's been beaten, right? They've seen it. So I think, I suppose shifting norms can happen and norm change can happen really quickly, but also there's quite a large variation in views. They just don't, sometimes the voice that's saying this isn't okay and this is impactful isn't given us a loud enough space, or isn't part of that conversation. And you tend to get these sort of blanket statements, and actually so then that's what's powerful about some of the interventions, is basically they're just giving space to think about those. I mean, the other thing we know about what everybody aspires to, that if you're going to change norms, you don't preach people about what they shouldn't do. You try and connect to what they aspire to be, right? And in relationships, people aspire to have nice relationships, right? Loving relationships, and that, and so also just how do you then, so quite an important part of the intervention components is an empowerment component. It's empowering women to expect equality, to want equality, but it's also communication skills. It's how do you resolve, families are facing massive pressures, economic pressures, social pressures. A man traditionally is expected to get an income, and then there's less opportunities, and women can get an income, but actually she's meant to be at home. There's all these things that are evolving in the context that couples are living in. So actually, how do you, part of the interventions is creating that space to go, well, actually, how do we change as a relationship? And so that, those interventions are essentially changing those dynamics between relationships, and then it can be quite mutually positive, because some of the things in the SASA intervention, we had interviews with couples. There was an embedded quality component. They had interviews with couples just to understand what that change was. And some of the change, men were valuing as well as women. So it wasn't about losing power. It was just changing the relationship. So it was about actually men would say, sex is better, right? We're closer, we're more intimate. I come home and my kids aren't scared to see me, right? Those sort of
Yeah.
basic things.
Mhm.
I don't know, people, it felt like, you know, there's this or somewhat a bit of a rut of expectation that people can get
Mhm.
stuck in, and your in-laws are going, well, you should be doing this and whatever. But actually that you could kind of recalibrate,
Yeah.
and actually something that is positive for both women and men, and then help
Mhm.
us, and in a way, you know, other men would be in the quality we're talking about. We're working as a team now, and we've got all these economic pressures. We need to
Yeah.
work as a team, right? And so I suppose it's, how do you use, like, how do you try and tap into people's aspirations,
Yeah.
and actually showcasing in a way, and through that change that they start to feel those benefits is
Okay.
quite an important part. I mean, I think at a higher level, sometimes there are events, you know, a woman gets murdered, there's some
Yeah.
extreme violence. That's the other kind of opportunity at a more policy level that we would try and
Yeah.
use. So you have materials ready, you know somebody's going to get murdered, a woman's going to get murdered when it hits the news. How do we then have go, well, actually these are the sort of policy reforms we need to
Yeah.
talk about. So there's a sad reality of when there's a spotlight, that policy opening
Right.
of opportunity, how do you make the most of it as well?
Yeah. What's so interesting about this, hearing you say all of that, is the breadth, I guess, of this work. You're going into like empathy, communication, emotionally understanding, cultural immersion, and then you're also going into like, okay, but how do I bring this to the policy table?
Yeah.
That's something I think about a lot as I'm doing my degree, because
Mm.
I'm trying to understand, I guess, all those dynamics, how they play in. But yeah, I'm gonna just try to get to my third question.
Okay.
So just getting a bit into, I guess, the nitty gritties of like how you exactly conduct these studies, because something I've kind of learned is that again, it's really hard to measure impact, and when you're measuring nuanced qualitative metrics, something like, you know, power dynamics or suspicion of partner infidelity, that's something that someone might be like, oh, that's pretty subjective. But you've kind of managed, or what I've seen through the studies, is that bringing about a quantitative way to depict these, measure these, and then show, oh, actually our intervention had impact. You kind of touched on this in your first question, but just the methodology of it, because we're doing our masters and it's really interesting
Okay,
to think
sure.
about that. How do you take something like that that's like subjective even, or, you know, then
So the early days, I mean, I was starting to touch on it, is how do you get into very behaviorally explicit things, right? Because, you know, even, you know, the early days, they would do surveys on violence and go, have you experienced domestic violence, right? And how one person defines that versus somebody else is completely different. So it doesn't mean anything. So the early work was just, how do we get, and it was 20 questions, short module that they're now that you can put in surveys, but they're very behaviorally explicit, and they're trying to reflect the range of behaviors that might happen in a violent relationship. For the multi-country study, we had 10 countries, so we were also trying to find questions that would work across different cultures, different settings. So what are the common things that happen all around the world? Being punched, being kicked. And we also tried to have a range of severities, so that you could go, this is somebody who's experienced moderate violence, this is somebody who's experienced severe violence. So being quite deliberate in that thinking, it was actually, for a survey in particular, we can't ask women about everything that's happened to her, right? Like, it's traumatizing. Actually, if we can get some of the common behaviors, that's enough to go, this is a case, this isn't a case, right? It's, you know, your sort of sensitivity and specificity, it's enough to go, this woman has experienced violence, this woman probably hasn't, this woman's probably had really severe violence. So there's a bit of being smart in that measurement to think in a way, and that you know, those came from qualitative interviews. In that work, we were partnering with women's organizations in each country, so they would help us think, what are the things that resonate and work across those contexts. So I think, and for me, you can ask people, what do you believe, but then you expose them into an intervention, and then you've got this real risk of response bias, right? they know they want they've maybe kind of done a whole lot of stuff about women are equal with men, violence is unacceptable. So then you ask them a question, well, do you believe violence is unacceptable? They'll go, yeah, right. Are they just saying what they know they should be saying? So for me, that's why it's been really important that the trials try and measure kind of attitudes, but actually our primary outcomes in the trials is about what actually are your behaviors, right? Behaviors are kind of very powerful, and that might be behaviors like violence, or it might be behaviors about sharing money or other things, but just trying to get stuff that in a way you feel is more valid, linked to what basically we're trying to change behaviors, that we want to behave, attitudes and norms as well, but ultimately does that all translate to women experiencing less violence is kind of the bottom line. So I've always put quite a lot of weight on that, and weight on what do women say versus men say, right? Because again, men are there are some other trialists who have had as a key thing, what do men say, have they used, how often have they used violence, but there's a response bias. So I've always focused on, I want to see what women say. What do women say? Are they what's their levels of violence?
Yeah.
I think there has been other work around some of the other sort of aspects around norms where people have thought quite carefully about how to measure it, but I think it is hard, and actually in a way behaviors are slightly easier because to measure, and for me it's been there. Some of the things we did play around with though on the attitude side is just trying to think about models of questions that aren't the obvious ones, so maybe it's less prone to repetition, or understanding. I'm just trying to remember it. We had some questions in the SASA trial about the acceptability of violence, and I think, well, I can't remember the specifics now. Actually, we were playing around with what's the stuff that we would expect might change because of the intervention, and what's stuff that's slightly less obvious that might not be affected by the intervention, just to see kind of what changes and what doesn't change. But it was a while ago, so I can't remember.
Yeah, it was a long time ago, I know. But that's really, really helpful. Thank you. I could ask about this forever, but I'm gonna let Ritika ask her questions.
Yeah, please.
Yeah.
No, so I'd love to transition a little bit into your work with policy as Chief Scientific Advisor. And I believe you came to this role during the COVID pandemic. And I was wondering specifically, oh, sorry, my mom's calling. And yeah, so I was wondering how you tied in your previous work with GBV prevention into pandemic strategy. And I was just thinking about lockdown and the risk factors associated with that, as shown in your research, like loss of autonomy, economic costs, economic reliance. And I was just really interested if you had to make a case for that in government. Is this something you had to argue for? And also, how did that ultimately shape your policy response?
That's a really, really smart and hard question to answer, because at one level, so when I went in as Chief Scientific Advisor, I was there to support everything that on science, right? And not just in health, and largely focused on development, but also the UK and particularly in COVID. So at one level, I had to be quite clear, in a way, not coming in and just saying my issues violence against women, right? That it was, what are the things, what's the evidence, who's vulnerable? Actually, it was the elderly who are especially vulnerable for COVID, right, of dying. So I had ended up doing quite a lot of work about care homes and things like that as part of my advice and sort of task and finish analyses that I did as part of the SAGE group. At the same time, what was good is Chris Whitty, and so he was Chief Medical Officer, it still is, and Patrick Vallance, the government scientist, they also wanted to understand what were the social dimensions. So then, and because the way it works, we have chief scientists in each government department, but for COVID, all of us were part of SAGE, and we would surge in where we can be useful. And because I can do both quantitative and qualitative and sort of epidemiologist, I ended up getting brought into a range of different working groups. And so I got brought into the working group that was talking about what are the wider implications of COVID. And that was everything from, speech and social development of young children through to issues of isolation and what that means. So in some of those areas, I was able to kind of reflect that. But actually, if anything, I was having to reflect it and highlight it, but then it would be a scientist from the relevant department that would have to pick up on that. But I was just trying to make sure some of the sort of gender dimensions were reflected in the kind of analysis. And then in the kind of work I was basically advising our health advisors who are around the world about what are the areas, and again there it was just highlighting the breadth of vulnerabilities, and that included both things like isolation, violence, but also loss of income and things that actually also have compounding factors. I think in that way it was quite easy to do, because in the network of advisors they have experts called social development advisors who are very attuned to issues of violence and gender, who are also reinforcing those messages. So it wasn't really me alone having to make those points, but it was in a way, because I was chief scientist, so I have this sort of status and legitimacy. In a way, it helped them to then think about those issues, because I'd be putting it in the briefs that I'd be writing to the minister about the impacts of COVID.
I was just thinking that there must have been so many trade-offs and opportunity costs to consider when deciding where to direct funding. And as someone that's coming, I'm just really interested to hear, as someone coming from academia into this new policy space, how did you navigate those decisions? And it must have been so different. I'm assuming you were handling a budget. And just deciding resource allocation. I think, first of all, I'm interested in that transition. And second, how you made those decisions about funding allocation, especially with COVID.
Yeah, I mean, so one of the jobs I had as chief scientist was managing the research budget. And there basically, it's quite a broad budget, but it included a gender component, which included violence against women research, included health, which in COVID pivoted on to support for vaccines, therapeutics. We pivoted money onto, and we had an existing partnership with Unilever for many years, and literally COVID was happening. We're like, what can we do for developing countries? And we like, actually, we need to get primary prevention right. And literally, I went with my deputy who held the relationship with Unilever, and we said, how much like hand wash and soap have you got? And can we deliver it across, like just increase? And we'd already invested in kind of hand wash messaging and tested it in different countries. Like, let's just do this at scale. So we literally, it was coming to the end of the financial year. So we went and had that conversation. We said, can we just get this stuff distributed across all your kind of LMIC networks? And because we had a trusting relationship, we had nothing signed, but we said, this is how many, I can't remember, it was tens of millions of pounds. And then I went back and said, how do we find that money? And it was getting near to end of financial year. So then I kind of knew I'd build up a bit of a network. I was going round to different people I was hearing had an underspend and saying, I've got I've got something for COVID that you can pull into. So we literally, like, Unilever just went and did it, and then we just made the money and kind of paid them, and covered it. But it was so in the budgeting, it's sort of prioritizing, but every so often you just spot this, like, actually there's this urgency and we're just going to go for it. And people talk about bureaucracies being slow, but actually sometimes you can make things move really quickly and people go, yes, that's really important, we're going to do it, right? And so that's what so there were times when we could act very quickly, and in COVID at times we were just acting really quickly but drawing on relationships. On the violence work, I was pleased when I came in that there was quite a big violence against women research program, What Works, that's gone. And so what I did there was just keep it and protect it, and make sure it kept on being funded. But also, and every so often it would be under pressure, just because of, even in COVID, right? Oh, it's COVID, we need to put all money into drugs and so on. But I had control on the research budget, so it was one of the areas I just thought, no, this is important, but also it was very unique that the UK was funding that, right? There weren't a lot of other funders doing it. So and there was a big established network. So for me, just sort of stressed its importance and what's interesting, and then started to think about how do we bring this agenda up onto I don't know if you saw the All In campaign that got launched. So that when I was in government, we'd done something similar on education, and education's easier. So then I was thinking, okay, we need to do something like that for violence against women. So just before I left, I was starting to set that up and go, how do we, with the policy teams, because I had research teams and policy teams, what's that equivalent look like for violence? And we funded the group to scope it and come up with a report and so on. So led by Emma Pulu. And so actually that was quite exciting for me because I'd left, but that happened. So I went to the launch. And it was the thing I kicked off, but it was there. How do we get that evidence into a political, take violence into that political realm?
Yeah.
And what's interesting now in the Foreign Secretary, the new Yvette Cooper, in her priorities, one of her priorities is I don't know what it is. The Foreign Secretary always has sort of priorities, and it'll be like Ukraine, clearly the Middle East, and there's sort of usually one thing that they can choose, right? And she's chosen basically women and violence. And so now that program the research program that I was trying to protect and I thought would get cut with the Yoda cuts, actually is now kind of fully supported. And now from Wellcome, I'm looking at, can I connect with them on mental health? And then there's this, Foreign Secretary actually speaking about the importance of tackling violence against women. And it always was a Ministry of Development sort of issue versus a Foreign Secretary. And now it's at the Foreign Secretary level. So it's quite nice. I feel like, okay, I played a bit of a role in that. And
No,
her commitment. Yeah.
I think that's been very humble. I think you've played a huge role in that. I think it's very evident, and I'm just also very mindful of your time as well. I just realized we have a minute left, so I think we're going to end it there. But we just want to reiterate how grateful we are to have you speak to us. I think we speak for both of us when we say we've just learned so much in this half an hour. And again, thank you so much, Charlotte. Yeah.
Oh, well, no, really lovely to meet you both. And I'm sorry my time's a bit restricted, but I know I appreciate that you're interested in this issue, and you're asking really smart questions. So I'm sure you'll do brilliantly in your masters.
Yeah, this was amazing. Thank you so much.